Hey guys, so we're moving on to chapter 21. I think we're going to kind of move this along pretty quickly because we're getting to the end and we need to kind of get this finished up. So I'm just going to start with this lecture. Please pay attention, follow along, and there'll probably be a question posted after just to make sure you guys did follow along. Okay. So we're going to be talking about head injuries, spinal injuries, starting out with anatomy. We should remember most of what you see here. We have the spine, the brain, and the spinal cord itself that runs through the spinal column, starting at the cervical, thoracic, lumbar, sacral, and coccyx. Um, we have seven cervical vertebrae, most delicate, most important portion of the spine. We have 12 thoracic vertebrae. We know that each one of these thoracic vertebrae actually line up with the 24 different ribs we have, 12 on each side. We have five lumbar, the strongest portion of the spine. We have five sacral, which are fused together. And then we have four coccyx, coccygeal, that are also fused together. And the last two, there are no nerve endings that run through that. Five regions of the spine we just discussed: cervical, thoracic, lumbar, sacral, and coccygeal. Okay, so head injuries, because where it starts at the very top and it's way down. We have basically what we're looking at here is a laceration, because as you know, an incision is a very clean cut. A laceration is more of a jagged edge, and this looks pretty clean, but it's probably been cleaned up by the doctor themselves. This is to the we look at it as the right frontal lobe of the scalp, and it looks like it's pretty much through the layers of skin all the way down to the skull itself. Swelling and bleeding signs, what we're looking for: altered mental status. We're looking at that closed head injury. We'd want to see, or we'd expect to see, altered mental status if we have any brain injury at this point. Weakness, numbness, or paralysis in the extremities could tell us spinal issues. Posturing, where we actually have someone who is physically moving their body. It looked like a seizure, but specifically their arms draw in, their hands draw in, their feet draw in, or which would be decorticate. Okay, it's referred to as decorticate posturing. The other is decerebrate, where the feet move out and the hands move out, and they shake during this. This shows us specific points of the brain that have actually been affected. Is what's called posturing. It's not a seizure. It looks to be like a seizure, but it's not. Pupil changes, we're looking for equal and reactive, but they may be unequal. Loss of balance, nausea, and vomiting happens with all head injuries. It's something we need to know about. Here is your unequal pupils. Couldn't be explained better. Herniation of the brain. We have shifting of the brain. Signs of herniation: profound altered mental status. Cushing triad, which is a decreased pulse rate, increased blood pressure, and abnormal respiratory patterns. Posturing could be something we would see, and change in pupil response, what you see right here. Now, please don't freak out. This kid is probably more than likely been a pupil dilated with medication for eye check. And this is the initial dilation. They can do the same on the other side. But it represents a perfect representation of unequal pupils. Concussion, mild to usually mild injuries, usually with no detectable brain damage. Temporary interruption of brain function. Signs and symptoms of this would be brief loss of consciousness, temporary loss of temporary altered mental status, amnesia, repetitive questioning. This is interesting when you see this for the first time. Seizures could be part of that. Nausea and vomiting, and incontinence, loss of bowel control. So in this respect, how do we end up with a concussion? We have basically a blunt force trauma to the head, and what happens is our brain does not have a lot of space between the skull cap and the brain tissue itself. So this is all CSF fluid, right? You get that blunt force trauma, your head goes backwards, but the brain, being not connected to the skull cap, lurches forward, smacking one side. And then the coop, that's the coop. The counter coop is when the brain goes the opposite direction, smacks the other side of the skull cap. It bounces back and forth, ping ponging back and forth. This bruising and forceful shift causes concussion: mild, moderate, severe concussions, depending on how bad that was. In an adult, there's less space than in a child. There's more space there. So the injuries can be more severe in a child. In this case, we talk about shaken baby syndrome. Open head injuries, signs and symptoms, obvious deformity of visible fractures, and we're down to the skull cap, and it looks like we've got a fracture inside here. Pain, tenderness, cerebral spinal fluid leakage would be nose and ears, but we can also see it from the scalp too if it's a true open injury. Pupil changes, battle signs, raccoon eyes, signs and symptoms of brain injuries. Also, the altered mental status, the confusion, uh, those types of things. And so, as you can see, this is a pretty bad injury we're dealing with here. This guy's not going to be doing good if we don't treat him properly. So maintain an open airway, breathing, stabilize the patient, the head and spine, reassess from head to toe, looking at the injury and treating the injury properly. Care for soft tissue injuries as soon as possible. Stop in there. Special circumstances. We are going to pretty much burn through this though, because we've got to start looking at paring things down and getting ready for finals. But other than that, I appreciate your effort, guys, and please pay attention. Look for the questions that'll pop up along with the video. Just a simple question afterwards. Okay, thanks. Bye.